All right, folks, it's 2.0 for House Republicans as they try to move forward on another repeal of the Affordable Care Act. You know, they've been complaining for 8 years that they have their own plan. Well, we've been waiting for it. And so now they say they have another one. This time, guess what they're doing? They're actually causing even moderate Republicans, if they so exist, to go, wait a minute, what's going on? We can't support this. So check this out. With their plan, they want to leave a lot of the decisions when it comes to coverage up to individual states. Now, as you might recall, last month, the first version of their Health Care Act repeal failed. It was a major defeat for President Donald Trump and House Speaker Paul Ryan. They never even got a floor vote. Okay, because guess what? It was going to lose. Now enter Congressman Tom MacArthur of New Jersey, the co-chair of the moderate House Republican Caucus known as the Tuesday Group. He quietly began having meetings with the leader of the House Freedom Caucus and came up with a compromise amendment. His amendment lets states decide whether or not to carry the essential medical benefits that were mandated under the Affordable Care Act. They include hospital care, pregnancy and newborn care, mental health and substance abuse care, prescription drugs, rehabilitation, laboratory work, and preventive care. Now, the McCarthy Amendment states that states could opt out of essential medical benefits, including hospital care, pregnancy and newborn. I mean, you go through this work and you're going, really? They could opt out of all those things? The amendment also lets states charge higher premiums for Americans who have pre-existing conditions.
We want to give the states the ability to kind of customize the reforms to maximize the ability to lower premiums and protect people with pre-existing conditions. And that is exactly at the heart of what the MacArthur Amendment does, and I think it helps us get to consensus.
The amendment also allows states to charge more for those with pre-existing conditions. So what's so interesting about this here is that was one of the criticisms they got in a number of town halls. Polls show that the majority of Americans do not want states to make decisions on what insurers cover, and they want to keep the provisions that President Barack Obama put in place in the Affordable Care Act, including coverage for pre-existing conditions. Now, the Freedom Caucus chairman put out his statement last night saying while the revised version still does not fully repeal Obamacare, we're prepared to support it to keep our promise to the American people to lower health care costs. We look forward to working with our Senate colleagues to improve the bill. Our work will continue until we fully repeal Obamacare. And Democrats who oppose the plan pointed out that the bill, folks, check this out, exempts members of Congress and their staffs from losing any of the provisions offered by the Affordable Care Act. So they want to screw everybody else, but they want to have a different for them. Joining us by phone from D.C., Leslie Dock, campaign director for Protect Our Care, a group fighting to keep the Affordable Care Act. Of course, our panel is still with us. Leslie, when you see this, and all of a sudden it's, oh, let's sort of have these separate pools of folks with already pre-existing conditions, the Republicans would do, and so they're following through with it. Really? This is what they call Affordable Care Act 2.0?
It really is outrageous, you know, they'll never tell you the truth about this. I mean, they had a bill, as you said, Roland, that was so bad they couldn't get a vote on it in the Republican-controlled House. So what do? They make it worse. So now we go back to a time where an insurance company decide that, hey, you have insurance, but it doesn't cover maternity care if you're a woman. It doesn't cover substance abuse care if you have a substance abuse disorder. It doesn't cover cancer treatments if you have cancer. And if that wasn't bad enough, they cross the red line on pre-existing conditions and basically say, hey, if you're an insurance company, in the end, you're going to be able to charge people whatever you want if they have an allergy, if you were ever sick, 80% of the American people think this is nuts. These guys can't, in town hall after town hall denied they were going to do this. But to kind of reclaim their political manhood, they're willing to sell us all down the river.
But here's what's amazing, Leslie. First of all, they're trying to rush this because they are desperate to have a legislative achievement for Trump in the first 100 days. This thing was done in complete secrecy. They criticized for Democrats for doing this with the Affordable Care Act But last I recall, there was some 350 amendments offered by Republicans. That thing was debated in this country for more than 14 months. This thing is as if they hid it even from their own members and just revealed it to them in the last 48 hours.
That's exactly true. Don't forget, they started this thing off by behind locked doors with security guards. The bill was so bad they didn't want even their own Republicans to see it. They've continued to do this in secret, and they end up with a bill. Let's not forget where they started. They started by taking 24 million people off of insurance, and according to the Congressional Budget Office, increasing people's premiums by 20%. They had this age tax that said, hey, the insurance company could charge anybody between 50 and 64 5 times as much as anybody else. They were going to gut Medicaid expansion, and meanwhile, give $600 billion to the wealthy and the biggest corporations. It's no surprise that they want this to be done in the dark of night, because with a little sunshine, it really begins to stink.
All right, Leslie Dack with Protect Our Care. I appreciate it. Thanks a lot.
Yep, bye-bye.
Let's go to our panel. India, Ralph Chittams, Julian Malveaux. Ralph, I'm going to start with you. Okay, you would think something this significant, folks would want to actually have dialogue, want to have debate, want to be able to go back and forth. What the hell are Republicans doing, essentially trying to do this thing in the cover of darkness and are desperate just to pass something to be able, for Trump to be able to say, yay, I did something.
Well, if you remember, I was the drum major leading the parade against the first attempt that came out of this Congress to repeal the ACA. I was way out front saying, no, this is a bad bill. This should not pass. And I was one of the few people who actually sat down and read that whole thing. Now, this second one, I have to say, it doesn't seem like it's very much better. Now, truthfully, I have not sat down, I have not read this version from cover to cover like I did the first one, but my initial reaction to this is I'm skeptical. It doesn't sound like it is going to get the country where it needs to go. And I agree, there needs to be more transparency, there needs to be more open discussion, there needs to be more dialogue regarding what exactly is going on. The devil is always in the details in these types of legislation. You know, you can say one thing in a soundbite, you can look at the bullet points, but it's not until you drill down and look at what is actually in the text that you can start really understanding the nuts and bolts. So at this point, I'm skeptical.
India, here's what's interesting to me. The insurance companies, let's just be honest, the insurance companies do not want to cover people with pre-existing conditions. Out of all the things in the Affordable Care Act, that has been the one thing Americans have said, do not touch. This is a money grab for the insurance companies, and the Republican Party wants to hand it to them on a platter.
Well, they're good. I mean, they're trying to hand it to them on the platter. The issue is, you know, there's only 30% of Americans who even think this is a good idea to start, right? And if you think about, so there was something a little something in 2015 that was called the Restoring Americans Healthcare Freedom Reconciliation Act. This is that repackaged over and over and over again, right? And so, you know, in terms of pre-existing conditions, nobody, like insurers, it's not in their best interest to insure this, is it? Because it costs them a lot of money. That's why they don't want to do it. But in terms of vulnerable Americans and ensuring that they are covered, we have to make sure, we have to carry on doing what we're doing. The ACA needs to stand. I mean, obviously, there are always things that can be improved or that can be changed, but we're not going to repeal it, and we can't repeal it. And I think they just kind of need to let this one go, because they're going to, what's going to happen is there's a little thing coming up called 2018. And if they keep on pushing, 2018 is going to look very different than it looks now. I think it's going to look very different than it looks now for a variety of reasons as it stands. But they need to leave us alone.
Roland,
Julian, go ahead.
The fact that they would exempt themselves from this lets you know what's wrong with this. If it was such a good bill, then jump on in, y'all, and have the same benefits that the rest of all Americans have. The 2016, quite frankly, we keep talking about Hillary versus 45, but 2016 was a victory for predatory capitalism. It was a victory for the ability of insurance companies and others to exploit people. And the exploitation we see is not only with the pre-existing conditions, how dare they they say that states can disallow coverage for pregnancy. So there's going to be a tax on being a mom. There's going to be a tax on being crazy. Because if they're going to deal with mental health issues as well, there's going to be a tax. We see the growing use and dependency on these opioid drugs.
Gotcha.
And there's going to be a tax on that. And so we're going to end up with people who are much worse off than they are now.
But didn't Congress exempt itself under the first ACA?
I tell you what's going to be real interesting, and that is, again, if the House GOP passes this, those senators are going to be so upset when they start having their town halls.
A peaceful protest turned deadly. 37-year-old black man was shot and killed by Baton Rouge police. His hands are in the air, and you still get shot by the cops.
Oh my God, please don't tell me he's dead.
We're not going to let hate define us.
Race is a big part of this.
If truly all lives matter, then all lives need to matter equally. What we require is action. What we require is accountability. We understand that black lives do matter, and we will keep focused on this issue.
NewsOne Now, every weekday morning at 7 on TV1.